And for more on the humanitarian crisis in Yemen, we're joined by Dr. Yasmin Haque in New York. She's UNICEF's Deputy Director for the Office of Emergency Programs. Thank you so much for joining us.
Thank you.
You know, hundreds of civilians have been killed, including 74 children in this conflict so far. Officials on the ground say the latest airstrikes hit a school, killing some students. How would you describe the unfolding humanitarian situation in Yemen right now?
It's really a crisis for children and their families in Yemen. They are bearing a disproportionate brunt of the crisis in a situation where they were already disadvantaged. We see high malnutrition rates. Only 1 in 3 children of primary school age was going to school, and there is widespread disease and access issues. This is just aggravating the situation, and whatever little gains we've been able to make in the past few years are going to get aggravated. It's really important that we get access. We have our staff and our team on the ground, but we are running out of supplies, and we do need a corridor which allows the supplies to go in and allows our teams to really garner whatever support is needed.
And that's the big question right now. How do you get in the middle of this conflict when there is so much going on? How does that have to happen?
Well, we have supplies on standby. We've had quite a large cargo waiting for the permission to go into Sana'a. And the moment we have permission, we would start going in. We have about 100 staff of our national staff on ground who are working with partners locally to provide whatever assistance is needed. We had whatever supplies we had on ground are being used in health facilities. The fuel that we had available is being used to make sure that the vaccine storage facilities remain active. And what we need is really a halt of the hostilities so that humanitarian assistance can go in.
Do you think that is realistic? You know, China's foreign ministry is adding to the international calls for a ceasefire, allowing aid and supplies into the country and also giving civilians time to get out if necessary. Do you think a military pause could really make a difference?
Absolutely. We need it badly. We need that pause so that children and women can get the type of support they need.
How difficult, though, is it to do that with so many competing groups and competing interests in a high conflict area like this one? You know, likely these parties will not agree to stop the fighting, much less help those innocent people.
And that's where the international voice is important. That's where we talk about it. That's where our partners on the ground are pushing for it, that whatever is possible in the circumstance is being delivered, but it's not going to hold up for long. And unless we come together as an international community to make sure that humanitarian access is in place, that children do get the service they need, we are soon going to see food shortages. There are already fuel shortages. Water has become an issue. Safe drinking water is not available in all areas. We have to come together on this.
Dr. Haque, I know there are so many different things happening right now there in Yemen, but what is your biggest concern?
Our biggest concern is making sure children are safe and protected, making sure that that parties to the conflict do take measures to ensure that they are not disproportionately hit. We already have a situation within the country where children have been affected by the conflict over the past years, and it has gradually been escalating, but now we're seeing it really at a time where we need to halt, we need to make sure that children remain protected and with their families.
All right, Dr. Yasmin Haque, thank you so much for joining us from New York.